Welcome everyone to the Yamazaki Journal Club, where we delve into impactful research. I'm your host Yamato, and I'm thrilled to have Dr. Satomi with us today. We'll be discussing a compelling paper about how a home visiting clinic impacted emergency transportations in rural Japan. This topic is particularly relevant as we consider sustainable healthcare systems in aging populations.
Thank you, Yamato. This research is crucial because it addresses a growing public health concern, the increasing demand on emergency medical services in aging societies. The study explores a proactive approach by bringing care directly to individuals within their communities through home visiting clinics.
Could you give us an overview of the research context and setting?
The study was conducted in Tome City, Miyagi Prefecture, which had approximately 80,000 residents, with an aging population rate of 35.5% in 2020. It's important to note that it takes over an hour to drive to a major hospital there, and the region has historically faced a scarcity of healthcare resources. The number of doctors per capita has been less than half the national average. The healthcare system faces significant strain with increasing emergency transports and hospital bed usage.
And this is where home visiting clinics come into play.
Exactly. These clinics provide planned, regular medical care to those who can't easily access hospitals. They offer various services including diagnoses, treatments for both chronic and acute conditions, and importantly, palliative care including end-of-life care. Until 2012, there were no clinics providing home visiting services in this area. The first specialized clinic was established in 2013.
How did they study the impact of this clinic?
They used a quasi-experimental approach, analyzing data before and after the clinic's establishment in 2013. They developed a standardized emergency transportation ratio, SER, which compares Tome's emergency transport rates with national rates, adjusted for population age differences. A value of 100 means the age-adjusted frequency matches Japan's average, with lower numbers indicating better performance.
What were the key findings?
The data showed a clear trend. Before the clinic's establishment, Tome's SER increased from 61.8 in 2005 to 89.6% in 2012. After the clinic opened in 2013, it began declining, reaching 78.1% by 2017. The number of regular clinic visits also showed significant growth, starting with just 25 visits in April 2013, increasing to 312 by April 2014, and reaching around 500 patients by 2015, maintaining that level thereafter. Notably, there was a sharp increase in SER in 2011 due to the Great East Japan earthquake, when many evacuees from coastal areas fled to Tome City, losing their previous healthcare connections.
What are the implications of these findings?
The results demonstrate that proactive, home-based care can effectively reduce emergency service strain. It helps patients manage conditions at home, provides continuity of care, and crucially offers end-of-life care. This is particularly important in Japan, where without regular home visit services, it's difficult to confirm death at home, often leading to unnecessary emergency transportations. However, there are limitations. Being observational, we can't prove direct causation. And while the study region is typical of many rural areas in Japan, we need validation in different settings.
What about future directions?
The study suggests exploring telemedicine to complement in-person visits, which could be more cost-effective. As LaPointe Shaw and colleagues reported, replacing some in-person consultations with telemedicine might be equally effective. We need innovative approaches to expand care access while reducing costs.
Thank you, Dr. Satomi. The paper we discussed today is a home visiting clinic decreased the emergency transportation in rural Japan, a quasi-experimental approach from the Tohoku Journal of Experimental Medicine. These findings underscore the potential of home visiting clinics to improve healthcare delivery while reducing strain on emergency services, particularly in aging rural communities. Thank you all for joining us today.